Debate is, be it resolved in a patient-centered care model that cardiac surgeons have a lot to offer in percutaneous structural intervention, and I'm arguing the con. I have some disclosures that are not that important. I would just say, first of all, beware the wrath of con. Very dangerous. So we're going to suspend political correctness, the team, our working environment for this brief debate. So Simran had some behavioral issues during his fellowship, and there was not a specific name for this behavior in that era. I think there's a name now. And he was allowed to graduate after the appeal, and that's all in the New York Times if you want to read about it. But there are some issues there with another trainee. In any case, I think I'll stop there. And I will tell you that this is not going to be very pacifistic and say nothing, because really, except for ending slavery, fascism, Nazism, and communism, war has really never solved anything. So war is good sometimes, and sometimes you actually have to stick to your guns about things that are important. The first question I have to ask you, are you kidding? Is this a joke, right? Is this a joke? Are we going to be dealing with other mysteries, great mysteries of the universe today? Who's better equipped to play in the NBA? Is that going to be Kawhi or my son? This is not really a big mystery. Kawhi's a lot better equipped to play in the NBA. These academic terms, clinician teacher, clinician educator, clinician investigator, there's a new term that I've established, and it's based on this poem from 1834 called The Rime of the Ancient Mariner, which describes a mariner which shot an albatross with his crossbow, and then his cross around his neck was replaced by the albatross. And having a surgeon in a structural intervention is really the surgeon albatross classification. The other new category, so...
You're like a baby, making noise, don't know what to do.
Easy. Well, if I'm like a child, then, look, maybe you should teach me.
Cardiac surgeon.
You cannot learn, you do not see.
Then teach me how to see.
No one can teach you to see.
Whoa. Look, come on, can't we talk? Say, where'd you learn?
TAVI anyway. Prison?
Wilhelm!
You're like a baby.
The most important thing is the cursing under your breath in another language at the end of that, right? So I'm going to argue that right is right, even if no one is doing it, and wrong is wrong, even if everyone's doing it. And really, this is an argument about being a part-timer versus having mastery of something. And really, the thing that distinguishes one performer from another, and this is from Malcolm Gladwell, is how hard he or she works, and that's it. And what's more, the people at the very top don't just work harder or even much harder, they work much, much harder. And the 10,000-hour rule states that really to become an expert, it takes about 10,000 hours. So, what exactly is the crossover between these two things? Let me respond by saying zero. Your ability to do an aortic valve replacement as a surgeon has zero to do with any percutaneous procedure you're going to perform. And actually, it's profoundly insulting to think that you're going to be able to do something that you've never been trained for. And let me be very specific. I have no issue with a surgeon that's done 2 years of intervention. What I have a major issue with is a surgeon who's only operated, who's spent 1 month an observer in a cath lab, now running a TAVI program. Very clear. It's a little worrisome when you're kind of distracted by something and end up doing it. I really think focus is really how you define yourself as a professional. I think you need to focus on things you're good at. And Simran brought up the Wild West. Aren't we better as professionals when we stay within our expertise, and don't we owe this to ourselves and to our patients? This is one of the most popular documentaries, and I use this slide frequently, Jiro Dreams of Sushi. Jiro is an 85-year-old who runs the only 3-star restaurant in Japan. He owns his own restaurant that has 10 or 12 seats in a subway station in Tokyo. And he is really believed to be the true master of making sushi, and that guy only makes sushi, and he dreams of making sushi, and that's all he does, and he is noted to be a master of it. And I think we should all strive, if you want to be a professional, no matter what you are, accountant, lawyer, whatever, plumber, watch this movie, because this movie is about what it takes to be a pro. He only makes sushi, he's a specialist, he's a professional. What does the Hippocratic Oath say? I will not be ashamed to say I know not, nor will I call in my colleagues when the skills of another are needed for my patient's recovery. TAVI was really kind of the Black Friday sale before Thanksgiving in the US. It's like, whoa, like, we got to get in there, like when there's a TV. And like, that's not the way to determine professional capabilities and activity. So, you know, it's a bit of a millennial mentality. Like, dude, like, I want to do that, but like, I can only start out at my Starbucks around 10. It's like, whoa, like, too much training. Like, we'll just get in there, check it out, and we'll be able to fix it up. And we know, like, what happens when it comes to shortcuts. If you look at Deepwater Horizon and what happened in the Gulf, you know what happens when you take shortcuts. It's basically you have big fires and big catastrophes. What are our patient expectations? Expert, on time, on target, and we need to be there. So I thought I'd put down some qualifications for TAVI, and it goes without saying you have to be an excellent clinician to start, but you've got to be an expert in interpretation of non-invasive studies, you've got to have formal training in percutaneous interventions and angiography, expert at percutaneous vessel access and closure, extensive knowledge of angioplasty and stem placement, and you have to be an expert at recognition and management of interventional complications. And we look at interventional cardiologists. I added 2 at the bottom, by the way. The last 2 are feels qualified to carry out procedures without adequate training and skills because they can sew, and delusions of grandeur with little foundations of little foundation reality. So the interventional cardiologist checks all the top boxes. Now, as a control group, I've taken a first-year kindergarten student, right? The first-year kindergarten student actually has no qualifications, but definitely ticks the last 2 boxes. And by comparison, the experimental group with the cardiac surgeons actually are very similar to the first-year kindergarten student in terms of their qualifications to do a percutaneous procedure. What is this driven by? Listen, it's no secret that the cardiac surgeons as a profession are hurting. Why? Because percutaneous intervention has improved substantially over the years. Their volumes have gone down. You know, it's happened for sure in coronary disease. And this is a paper from last year looking at the projections for TAVI in North America and the world in terms of volumes. And you're basically looking at a doubling of volumes most places around, most countries around the world when it comes to TAVI when you incorporate low risk. So then, you know, to be very honest, like, if it's not working out for you, like, just because you grew up and you want to be a cardiac surgeon, like, so like I wanted to be president of the United States, but guess what? Like, I'm Canadian, so that's not going to happen. So, you know, just because you grew up and you want to be a cardiac surgeon, like, you know, if you're not kind of top dog, like, you may fail at that. And you know what, maybe there's too many cardiac surgeons right now, or maybe cardiac surgeons need to, as a profession, need to think about what's going to happen in their profession. You know, Elizabeth Kubler-Ross wrote this book on death and dying, and there's really a process of this kind of dying process in cardiac surgery. So the 5 stages as they apply to CV surgery. One is denial. So these new toys they have will never last. And that was a quote from Fred Moore at the first North American valve meeting when we started talking about TAVI. He said, the cardiologists are killing people. No one's even paying attention. Number 2, anger. What? Another day with no cases. What's going on here? Where are all the patients? Bargaining. Sir, I know you have normal coronary arteries, but a bypass will help keep you going when plaque starts to develop. 4, depression. I'm going to have to sell at least one of my cottages. 5, acceptance. Well, I'm not going to do as many operations as I used to. And then the 6th stage, specific to cardiac surgery, well, I'll just replace it with some TAVI. So how did surgery even get close to this? The concept of the heart team that Simran so eloquently brought up. Let me ask you all a question. Who coined the term heart team? Was it a multidisciplinary group of professionals in Sweden who started doing this together? No. Was it someone, a European scholar, a doctor of philosophy who doesn't practice medicine who thought they should be applied? The person who coined this term was Larry Wood. Larry Wood is the senior vice president at Edwards in charge of transcatheter valve therapies. And Larry's whole thing was, Larry mentioned this to me for the first time in 2006 when he came to Toronto when we started our TAVI program, and he said, look, we're like a surgical business. Our customers are surgeons. We have a technology that, it's our customers, like we got to kind of involve them. And a business guy in charge of selling you stuff, kind of like a cigarette company or, people who process food for a living, decided that this is the way it's going to work to protect their customer base. This is not based in any deep philosophical concept about sharing who's right, who's wrong. This is based on protecting the business, okay? And Larry's responded here, by the way, if you want to read that. So how did the guidelines evolve? Well, let me tell you, because I was involved in the TAVI, multidisciplinary TAVI guidelines in 2012 with all the professional societies. And basically, the surgeons took the guidelines hostage and they said, okay, unless we're 50-50, we're not signing off on any of this. And that's what happened. And so very, very clever and very well played by our surgical colleagues. We talk about wire skills. Well, you put in a balloon pump, you got wire skills. You put in the wire, there's the skills right there. The wires are all there, right? Got a couple of wires, throw out the wire, throw a balloon pump. That's it, man. I've got wire skills. Teams normally have members with complementary skills and generate synergy through a coordinated effort which allows each member to maximize their strengths and weaknesses. Each member plays a valuable role, but not every role. And this is really similar to having two left feet. Doesn't work that well, right? More like a genetics consult, right? So look, I think I'm going to close here. It goes without saying that, doing things outside your expertise is a big problem. So this is a young woman who died after liposuction by a family doctor who was left in a recovery room and arrested. And really, I think the pendulum is actually starting to swing the other way. We know that you need to know what you're doing in order to do things. And in mainstream medical press, this is a quote from an abstract. There are a plethora of unaddressed issues, some of which are sentinel to our country, which threaten to make the heart team concept a perfunctory exercise. As it stands today, heart team is more of a fictional euphemism, a kind of platonic illusion rather than a pragmatic reality. So then who should do structural? First question is, are you kidding? 2 is avoid the surgeon albatross. 3, not having enough cases to do doesn't make you an expert in something else. 4, spare your interventional colleagues the pain of doing a case with you. And do the TAVI patients a favor, take up golf. Thank you very much.